conversation for us. And of course, check some of the facts that we've spoken about this morning on lipoma. We have Dr. Beju Adeniro. She is a clinical and public health physician with over 15 years experience providing medical care at patient and community level. Good morning.
Good morning. Good morning. Thank you for having me.
I mean, we commented on your hair before we came on. It's so beautiful. I love it. I'm a huge fan of everyone keeping their hair, and that is wonderful.
Thank you so much.
All right. Now let's get into the conversation this morning on lipoma. What is lipoma?
First of all, I have to say that I was just outside the studio listening to the conversation, and I was extremely impressed with everything. Nothing was on off point.
Yes. Thank you.
Yes. So I don't know why I'm here, but yes, basically, yes, a lipoma is basically a collection of fat cells which have organized themselves into a mass, usually just under the skin, usually less or between about 2 cm to 5 cm. It usually doesn't grow bigger than that.
Okay.
The way to distinguish it from any other kind of mass growing under the skin, first of all, it's directly under the skin. And if you touch it, you can feel that this is under the skin. It doesn't go
as we can see on the screen at the moment.
Absolutely. Yes, right. It's just under the skin. It doesn't go lower than that. It's usually, because it's fat, it's squishy.
So it's not hard. So it's not hard. It may not be lipoma.
Yes. So it's fat, so it should be squishy. You should be able to squish it, and it's also usually painless. So squishy, I say squishy because there's a difference between squishy and rubbery.
Okay.
Right. So basically, what you should be able to do is to be able to squeeze it with no immediate bounce. There shouldn't be resistance when you. So basically, think about one easy way to look at it is, because we're talking about fat, you pinch your buttock, and that texture, right, is what you're looking for. So if it's the texture of your buttock, then it's most likely to be a lipoma because it's fat. Or if you squeeze your cheeks, for most of us that are adults now, it's not so, but if you squeeze a baby's cheeks, that squishy texture, that's the same thing you should get from a lipoma.
Okay.
So hallmark description, just under the skin, between 2 cm to 5 cm, squishy texture, painless. It should be painless on walking or doing your normal day activity, and even when you squish it, it should be painless. Right. So basically that's what it is, because it's just a collection.
So I mean, you said something about squishing, and we've addressed that, but then you said something about rubbery. So when it is that way.
Okay. So first of all, the thing to know is that a lipoma, one easy way is anything with oma behind is usually referring to something as benign. What that means is that it's not a cancer. And OMA means that it's not going to cause you cancer, it's not going to grow, it's not going to cause you systemic problems. It's just, at best, irritating, dormant, irritating. So that's the best. Except a sarcoma. That's the only kind of oma that is problematic. So with a liposarcoma, and that's the reason why we need to distinguish, a liposarcoma is made up of fat and then muscle cells that have become cancerous.
All right.
Okay, so that's a sarcoma part. So bits of muscle cells that have become cancerous. Similar to lipoma, usually it will grow beyond 2 to 5 cm. It will not be painless. It usually will come with pain, and then it grows very rapidly. Another thing I forgot to mention is that lipomas grow very slowly. So you can have one and it will grow either not even grow perceptibly, so it can be in one spot and it will take 10 years for you to even find, it will maybe start from 1 cm, it can take 5 to 10 years before you can even get to that 2 cm. And it's very slow growing. Fat by definition are not very active, so it's very slow growing. Liposarcomas, however, are very rapidly growing. So you would have that lump or that mass, and within a year, 2 years, 3 years max, you can actually perceptibly see the difference. And the reason why liposarcomas are therefore painful, one of the reasons is that they stretch the skin very quickly.
Interesting.
They stretch the skin over the very quickly. Lipomas, because they're growing very slowly, one of pain is a response to the nerves, right? So the skin finds time to actually, adapt to the slowly growing lipoma. So most likely lipoma will be painless because your skin will attach. But will adapt rather. Liposarcomas grow very rapidly. Their texture is not squishy. So it may not be painful doing your normal day activities, but what you find is if you try to get that squishy, you won't get squishy, you kind of get rubbery, which is different. I'm trying to find out what texture I could, but rubbery has a little bit of resistance.
So it's not hard, but
it's not hard, yes.
Yeah, it's not hard, but yes. you can but it's not.
Absolutely. If you've ever touched silicone, I guess.
Silicone,
yes, that texture bounces back, right? It often
okay.
bounces back. And then when you squish it, it's painful because the skin over there has had to rapidly expand because, like I said, liposarcomas are really
grows rapidly.
It grows rapidly. So those are easy community level ways or patient ways to find out, distinguish. However, one of the things I completely agree with is the distinction between a lipoma and a liposarcoma can only, absolutely only be made by a doctor. Preferably a surgeon. Or a doctor with surgical experience. So please do not sit at home. Even if you have a lipoma, and here's the thing, when you do get a lipoma, it's often, because like I said, it's not going to harm you, it's often cosmetic. The common sites. So one of the factors, even though nobody's really sure why lipoma happens, but looking at some of the data, interesting data, is that a lipoma, so the question, why do fat cells behave abnormally? One trigger is trauma. So a lipoma can happen. So when we have trauma, you get hit on the skin, the body is supposed to heal. Unfortunately, sometimes if there's fat around that area, and nobody's really sure why, there's a genetic component to it. Instead of the body just healing and moving on, the fat cells there just become angry. That's the word and then they begin to organize. Right? So trauma. So because of that, you see lipoma. If you can think about it, and many of the patients that I've seen when I worked in, when I was patient facing, is that when you sit down and take a good history, they can actually relate to some trauma that they suffered at that spot. Now the lipoma can then come up in 6 months, 7 months, or even a year. So it's very difficult, except you're somebody that pays a lot of attention, to say, to connect the two. But if you take a very good history, focused history, a gentle history, a long history, you will be able to see that there was some kind of trauma. So common sites that you see that patients present with lipoma is on the head, on the shoulders, visible places. And that's because it's only when it's visible that people are concerned about it. It's cosmetic. I've seen lipomas on the head. I've seen lipomas on the chest. Sometimes on the head, the head is quite bony. You might have a trauma there, and while it's healing, the fat cells just decide to organize, like I said. You can have it on the shoulder. Shoulder is also bony. You have a trauma, and the fat cells there organize. Funny enough, I have a lipoma. I do have a lipoma. My inner knee. Trauma when the days when I was fit farming, this was a gym injury, and then the fat cells they're organized. Right now, I know it's a lipoma because I've done the relevant test. Which we can easily go into. The relevant test to do for lipoma, first of all, see your doctor. They'll take a very good history. If you take a good history, a gentle history, you will be able to connect some kind of trauma happened a couple of years ago to the lipoma. Then you want to do imaging, because you want to take a look at what exactly it is. They can ask you to do an X-ray, they can ask you to do an MRI, they can ask you to do a CT scan, depending on where the lipoma is. Gold standard is a biopsy. You want to take a fine needle, you want to go in there, you want to take samples from it, and they're going to look at the sample under a microscope and then see what kind of cells are there. Right? With a lipoma, you will just see fat. So those are the steps you need to go through before the doctor then says, oh, you know what is a lipoma. When we have a diagnosis, then we can go further. do you want to remove it?
So you mean that you can get to a point where you are the one that would make a decision if you want to remove it or not?
Absolutely. Lipoma surgeries are elective. If it's not causing you any grievous harm, you can actually elect to leave it. So that means that you should go to that doctor every 2 years, every 3 years to monitor.
Okay. If you don't want to remove it.
Yes, if you don't want to remove, if you don't want to do surgery, and that's absolutely an option. But it means that you don't get to go home and come and say for 20 years you're not going to. I regularly get mine checked. I always say, make sure you get it checked. The doctor will follow up with you, asking you questions like, oh, since you were here, have you seen any changes? Has it become rubbery? Is it now painful? Has it rapidly increased in size?
Okay.
Maybe another 10 years or another 5 years you want to do another biopsy. Just check. You know, and only then can we say, oh, you know what, you can elect to remove it. However, there are other compelling reasons why people might want to remove their lipoma. If you have a lipoma on your head, it's disfiguring, people might ask you questions they love.
It's always a conversation starter.
It's always a conversation starter. Yeah. If you have it on your shoulder, or if it's causing you a reduction in your daily activities, because, you know, it's a swelling. So, supposing I had one on my shoulder, it's not painful, but if I wore this, it's uncomfortable. It will rub against it, and sometimes because of the rubbing you can then have skin bruising, reactions, right? So the decision to operate is weigh a lot of factors, cosmetic reasons, and it's fine. It's very valid for you to say, I don't like the way it looks and I want to remove it. Or it's causing a reduction in my daily activities. Or I don't like the way people talk about it. I hate the way it rubs on my, you know. So then you can make that decision. Should you elect to not remove it, then you should be followed up. Make sure you go to your doctor. Make sure you're having a conversation with your doctor. You have a close relationship with your doctor.
So I like that, you know, you've worked with people on the community level, so it gives you the opportunity to explain it as explicit as you have done it, because, you know, there are times whereby you speak to physicians and they use very technical terms and it gets very difficult to understand. Now, talking about working at a community level, how often do you see people with lipoma?
Okay, that's a very good question. And I started out as a patient-facing physician, in which I would see the one patient that came in to me, and when I did work in a surgical position, I did see lipomas. It wasn't the number one thing we would see in clinics, but we did see lipomas. More women than men. Of course, women have better health-seeking behavior in the first place.
Is this a fact or
it's an absolute fact that women have better health-seeking behavior? And then the second thing is that because lipomas are often disfiguring, you know, for cosmetic reasons, you can understand that, you know, a female patient might feel more inclined to come in. A male patient, if it's not on the head, they will never come. And then, you know, so we saw more women than men who would then present, and then we look at the site that it is, and then we will go through the options to the patient. And you know, so I would say about 90% of the lumps that we present, because what you're saying is a lump, you don't call it a lipoma until you get a diagnosis. About 90% of the lumps that would present would actually be, in fact, harmless lipomas, right? We do go through a lot of trauma every day. We don't know, we get on the bus, and we don't, you know, so we do go through a lot of traumas, and sometimes things, especially when there's a genetic component. So personally, while I know it's possible and while I know it's out there, I've never seen, in my personal experience, a liposarcoma. This does not mean it does not exist. So about 90% of painless lumps with a squishy texture under the skin will be, in fact, lipomas. But I still do not encourage people to sit down at home and make that themselves. Then I transitioned from patient-facing to public health. And oftentimes, I would then see patients with lumps at medical outreaches who would come and say, oh, I have a lump, could you check it out? It's very difficult at a medical outreach to give a diagnosis. But at the back of my head, I knew I was more likely seeing a lipoma than anything. But it's not in the patient's interest to say, oh, that's a lipoma, because I need them to go and check it out. But I know that they're more likely lipomas. So what I have seen, I've seen more women, again because more women present, or maybe it might be too early to say more women are likely to have it. I could be looking at data that is skewed because more women are coming forward.
So exactly.
They're coming forward because women have better health-seeking behavior. That still stands.
Yes, I agree with you.
That still stands. So more likely to be women, more likely women in their 40s to 60s.
Yes.
Because like I said, we suffer the traumas early, but the changes don't happen. And then it takes a while for it to grow. So maybe you suffer the trauma in your 30s, it's 1 cm, takes another 5 years to become, so more women, 40 to 60, and many of the painless swellings are in fact lipomas.
So I've heard, now this is ringing in my head at the moment, lipoma is painless.
Yes.
And until when it starts to feel differently from the squishy part, then it may be something else that you need to check out very. But in all, when you find something on your body, you should check it anyway. So don't just sit down and diagnose it yourself.
If you come to me, I will never tell you it's a lipoma. Even if I know that, I will never tell you, because that's going to make you say, oh, I'm going home. I'm going to go and sit down. I will make you go through the process, even if I know that's what it is.
Because you need to be sure.
I need to be sure as well. I mean, so, and then when we know, I will ensure that we keep in touch. You see me every 3 years or so. We go over it. We look at the texture. We check for pain. We look for any rapid growth. And only then can I tell you. And then one easy way, one quick way is if you have a liposuction because of our skin. If you have a swelling that has stretch marks.
Okay.
And that's because the skin is rapidly stretching.
Yes.
That's usually not a good sign. So any skin changes rapidly, just go in and see your doctor, because it's growing, or there can be some kind of rapid changes going under the skin. That's the skin is a good indicator, and you have to keep your eyes on. It's a good indicator of what's happening underneath. But if the skin over is smooth, no rashes, or it's likely to be a lipoma. But again, like I said, I will not tell you that. I will rather that you go and find out yourself. Yes.
But then, does it pose any risk? I mean, I know you've said it's painless and all that, but are there risk factors?
So risk factors for lipoma, like I said, is trauma that could have happened before, and then women, and then older age. Is there a risk that you can suffer from lipoma? Obviously, it can just cosmetically, and then if you have a lipoma that is sticking out of the skin, it's subject to injury because there's something sticking out of the skin. You could be walking, and then what happens is because it sticks out, it can hit somewhere, and it may hurt. So the difference between when the lipoma is painless because you just hit it, and when with no trauma, it's painful. That's the difference. Normally, if you don't hit it or anything, it's not painful. However, remember I said lipomas can grow because of trauma. So because they stick out, you hit it again, because you will hit it because it sticks out of your body. That could also cause even more fat cells to organize. Because what has happened then is that fat cells are organized. The trauma signal is not supposed to. Trauma just says, oh, we've had an injury here. White blood cells go there, go and heal the place. Fat cells somehow miss the memo. They go there, and then they just do something they have no business doing. They just sit down. So imagine fat cells just sitting down with placard, just sitting here, just saying we die here. I'm like, what's happening? But that's what they do. They just sit there. And then, they call other fat cells and say, hey, come and sit here. So, and fat cells are, by definition, they're not very harmful. They're chill. They're chill. So,
I mean, there is this question I want to ask. It is squishy, so people are tempted to pop it. How dangerous can that be?
You can't pop it because squishy doesn't mean it's filled with air. It's squishy, but like I said, your buttocks. You can't, that texture is not like air filled. It's filled with something you just can't, squish. And there are people who go to and say, okay, I want to cut it. There are many layers before you get to the lipoma. Not that it's not under the skin. So if you cut your skin, you obviously see blood, then you see fascia before you get to it, right? I've removed a couple of lipomas when I did work in the surgery. So it's encapsulated. So that means that by the time you open it, it's really just, they form the capsule around themselves. Like I said, they've organized. So you are likely to be able to go and pop it outside the theater and get any kind. What you're just going to see is traumatize yourself and possibly have another lipoma.
After traumatizing yourself.
After traumatizing
In fact.
yourself. But I think the question that I think people, if I remove a lipoma, is there a chance of it coming back?
Yeah.
That's a very good question. If you collect everything within the capsule and you leave no errant fat cells in there, there's very little chance of a recurrence. Right?
Okay.
So, but if you, and that's why you have to ensure that when you, as a surgeon, when you remove the lipoma, you have to ensure that you remove it with the capsule on. There's something called the capsule. So you have to make sure that all of it is gone. All of it is gone. And then you want to look around the place and make sure all of it is gone. Right?
Yeah.
So post-surgery, you will do another imaging to see, because fat cells will usually come up whitish. So post-surgery, you want to do another image to ensure that you got all of it. But if you got all of it, there's very little chance of recurrence.
Yeah. So another question that has been popping in my mind is it hereditary? And this is why. You were saying something about trauma. We go through trauma every day, and then of course there are genetic factors to these things. So can this be passed from generations to generation?
Yes, it can. There is a genetic component. No one is really sure why some families can have lipomas, but yes, you can have a great-grandmother or somebody it means that you are prone to lipomas if it runs in the family. Yes, there is a genetic component, but lipomas, they're not very, very well understood, to be honest. But then, yes, there's a genetic component to it.
I love that we had this conversation today, because it has really enlightened me. I was telling Yemisi before we had you on the show that there's this particular show that I see on TV, and there's this doctor that's always popping pimples and also talking about and then talking about lipomas and all of these things. And I always wondered what this was and how you can get rid of it, because people come complaining that is, especially the ones that come up on the head, and how it makes them feel, the ones in the middle of the head and the body and all of that. But now that we've had this conversation, I know for a fact that it is not painful. It is not, and it is not cancerous.
And it's not cancerous.
Yes.
So it's not big. It doesn't grow. Slow growing. So about 4 things: slow growing, painless, squishy texture, no skin changes over, and then usually between 2 cm and 5 cm.
Thank you so much.
Those 5 things. Thank you.
Now you have those 5 things that we've learned this morning, and if you know somebody or if you've seen it on your body, the first thing that we advise you, as she has said this morning, is to see your doctor. Don't go there touching it and feeling that, I'm good. It's not painful and all of that, because I realized that when something isn't painful, we don't really care about it.
Absolutely.
Like you already said, if it's not showing on your face, if it's not growing around where anybody can see it, if I can cover it up, it's not painful, I'm good.
That's absolutely the wrong thing. It's likely to be harmless, but let a doctor who's qualified to do so tell you that, and that way you can sleep well at night.
Okay, thank you so much, Dr. Pedro, for coming this morning.
Thank you for
really enlightened me on this particular conversation. As you have heard, if it is not painful, if it is not giving you any discomfort, you should still see your doctor, because you're not a doctor.